Welcome. I am a RN BSN nurse. I have over, I guess I'm getting old. I have over 16 years or about 16 years. I started healthcare in 2006, but as a registered nurse, I've been a nurse for pretty much 8 years. I make videos for nursing students, new nurses, or if you're a nurse that's been a nurse for a while and you're lacking that motivation, or if you just need to stop by for some extra knowledge in an area that I might have a little more expertise in, then welcome. So this particular video can pretty much target more so nursing students. I want to share this video for those of you who are currently in the clinical setting and one of your tasks is to pass medication. So if you're successfully checked off and you're ready to pass medication, then super excited. Okay, so I just want to make sure that you passing it safe and just give you some things to think about before passing those medications. Okay, so the first thing I want to share with you are the medication rights. Now, notice I didn't put a number to it because every time I look up, they change it. First it's the 5 rights, then it's the 6 rights, then it's the 7 rights, then it's the 8 rights, and then the list goes on. So I've been out of school for a while. I've been a nurse and I'm actually practicing. So I'm going to share with you the rights that I know of. Now, you could keep count, but in this video, I will pretty much probably list 5 rights. Now, whatever your college teaches you, they might have added extra, but we're going to go with these rights. So the first right is the right patient. Definitely want to make sure that you have the right patient when administering medication. 2 ways to do that. One way is to ask the patient to tell me your full name. John Doe. Okay. When is your birthday? August 26, 1985. Okay, so you want to make sure you're asking this patient their first, last name, and date of birth, because sometimes we have patients with the same names and hopefully not the same date of birth. So you don't want to assume you got the right patient, because sometimes having 2 patients with the same full name can trigger a warning. So make sure you're asking for the right patient, and make sure you're asking the patient for their full name and their date of birth. Okay, y'all, so the next thing I encourage you to do is make sure you have the right medication. So always look at the medication, look at your MAR, and make sure it's the same medication. Oftentimes when some nurses are trying to do away with scanning and they grab something that looks like another medication or it sounds like another medication, that's when errors can occur. Now, they do have barriers that are set to block us, to prevent us from giving wrong medications to the right patient or whatever. We just have to make sure we're following along and going with those things that are set up to block us from making med errors. And one thing is we're scanning medications. So always make sure you scan your medication so that it can trigger if you're scanning the wrong medication. Another thing you want to do is also make sure that you have the right dose. So sometimes we might receive a medication, and if we know commonly that, okay, when I give morphine, I give 2 milligrams. So when I give morphine, I give 0.2 milligrams. But if I give morphine and the order say to give 20 milligrams, and that's something that I'm not used to giving, you definitely want to make sure it's the right dose. Now, some medication, depending on what location they're in, whether they're in the OR, the ICU, the orders might be a little different from the unit. So just make sure that you're confirming. You definitely don't want to never be afraid to confirm that you're giving the right dose to your patient. Okay, next you want to know what route. There are many routes. You have per rectum, you have PO, which is by mouth, you have IV, which is intravenous, IM, muscular, and the list goes on. If you have to give medication, so let's say if you're treating DKA, diabetic ketoacidosis, and if you have 2 things that they give part of the algorithm, well, there's more, but like when you're giving insulin, typically we give insulin sub-Q for treating high glucose, everything else. But when you're treating DKA, and they're given the potassium, they're given dextrose, they're given insulin. They usually order for the insulin to be given IV, intravenous. Also, if you have to give potassium, and we all know there are different routes to give potassium, and we know which routes you want to avoid, right? You never give potassium IV push. You can either give potassium via oral, you can give potassium via intravenous. So just make sure you're looking at the routes of administration. Okay, so another thing is the time, the frequency of the medication. Remember that your medication order is not complete unless you have all of these specific things noted. So you do need the time, how often you're going to give it, which is the frequency. So let's just say a medication. So we have Coumadin. So at my facility, we typically give Coumadin at 5 o'clock. Now it could come at a different time, but mostly I see it ordered around 1700 hour. So make sure that you know the time frame for certain medications. Some medications are given at HS, which is bedtime. So know which medications that you give in the day, know which medications that your hospital give at night. And some medications are given at night due to the side effects. So when you experience side effects of the medication, you usually sleep through those side effects. Some medications are given in the daytime. Okay, and my very last one is documentation. Document. I've said this before and I'll say it always. Make sure you have the correct documentation. Now that we have went through all that, let's just go ahead and get into some role play. So now you went to the Pyxis, you grab your medications, you're getting ready to go in the patient room. And now, what are some things you want to ask yourself before you go in the patient room? Number one, I encourage you to know which medications you're giving. Know if you're giving a beta blocker, what are you going to check? Are you going to make sure the patient pulse rate is above 60? If the pulse rate is lower than 60, then you definitely want to be reaching out to that cardiologist to find out at what parameter should I be holding this medication. Another medication is if you're going to give potassium. So if you're giving a potassium supplement, I will hover over there to the labs, look and see what the potassium is. If your potassium is already over 5.0, you might want to hold off and ask the doctor. So again, anytime before you can hold any medication, you definitely want to be reaching out to the doctor to make sure it's okay to hold a medication. If you know a patient have a procedure coming up at 10 o'clock and at 9 o'clock you're giving them their medications because it say NPO except for meds, meaning that you can still give meds, and you so happen to see that they have an anticoagulant in there, Lovenox, whatever, heparin injection, you might want to make sure it's okay to give that, because chances are if they're going to be doing any procedures where they're cutting into the body, they're going to want you to hold that. So know what medications you're giving. We're giving medication before walking into the patient room. I encourage you to, number one, make sure you know the patient vital signs. If you're walking in there with blood pressure medications, if you're walking in there with any kind of medication that can cause some type of side effects, know what kind of medication you're giving. So if you're scheduled to give, let's say metoprolol or lisinopril, hydralazine, any type of blood pressure medicine, but you fail to check to see that the patient blood pressure was already 88/50, and then later your patient care assistant comes and tells you, hey, the patient blood pressure is 70/40, then you realize that you gave a blood pressure medication that further lowered the medication because you never went and checked to see what the pressure was from the beginning. So make sure you know that. Also, if you're giving something that has like a sedative effect, Seroquel, have a patient that's already drowsy, lethargic, and you have a medication with a known side effects that causes lethargy, drowsiness, whatever, you want to make sure that it's appropriate to give that medication. Again, I don't know how many times I'm going to say this. Make sure those vitals are accurate, and just also know that everybody in the hospital respirations are not 18. That's important to know. So when you're given a medication such as morphine, Dilaudid, Tramadol, Norco, any kind of narcotics that can further suppress the respiratory system, you want to make sure that you accurately have these correct numbers documented, because if you go in there and give a medication and the respirations are 8, and then they're trending down, you're going to have a big problem on your hands. So make sure you know those vitals and assess them yourself if you need to. Another thing I would highly suggest is making sure that you review your list of meds with the patient. The worst thing you can do is go into straight scanning the medications and then popping them all in a cup, and then you have about 20, 30 pills in one cup, and then the patient asks you, well, what am I taking? Oh no, I don't want the Eliquis, or I don't want the metoprolol, or I don't want the Colace. And if you don't actually know what that pill look like, you have a problem on your hand, because now you have all these medications in the cup and you don't know which is which. Reviewing those medications with the patient, it serves two purposes. One, you can eliminate that first problem from happening. And two, you can kind of find out if there is a new medication that the patient is probably taking for the first time. Then that can be the opportunity to educate that patient on that medication instead of waiting till discharge to be trying to educate a patient on the medication that they're going to be newly taking. And this will have given the patient the opportunity to ask questions about the medication while they're currently taking it. Overall, I just want to encourage y'all to practice safe, know your medication rights, know what you're giving. Even if you just know the class of the medication, know what you're giving before you walk into a patient room. Chances are you walking into a patient room, the medication you don't know and you take in there, that's going to be the medication that they're going to ask you about. And the last thing you want to do is be looking like a deer in the headlights, because that's not going to give the patient a sense of security to know that they're in the hands of a safe nurse. So know what you have to, what information you need before you go in there. If it's a medication you don't know yourself, make sure you just jot down a small little information about the medication in case they ask you. So once again, thank you so much for stopping by. If there's any questions that I didn't answer, if there's anything you're left unclear on, please drop a comment down below and I'll be sure to get to you. And as always, thank you for stopping by.